We have been seeing a new advancement in the healthcare IT space just after COVID. A lot of things in and around are changing. A lot of people are embracing new technologies in the healthcare, especially the global healthcare IT space. Now it is brimming with new advancements as health information technology has revolutionized patient care and healthcare services across the world, not just even in India. And healthcare IT provides secure sharing of patient information for healthcare providers to better manage patient care. Now, patients are able to access their EMRs, their diagnostic reports on their mobile phones, and also doctors are able to give online video consultations to their patients. A lot of things have changed pre and post COVID. Like during COVID times, the use of healthcare IT was felt much more valuable than ever before. So we at Medicircle are presenting to you the Healthcare CIOs and IT Manager series with the eminent IT personnel of healthcare, wherein we are discussing the challenges and opportunities that healthcare IT shall bring about to the world post-COVID, because we genuinely feel that like the disruptions that are happening in healthcare, the technology disruptions, it is actually due to the CIOs and the IT managers, because these are the people who are implementing the solutions, the softwares, and actually enhancing patient care delivery process. So to give them recognition, the series is planned. Hi, I'm Smita Kumar, and in the series today we have with us Mr. Kishor Gojiya. Mr. Kishor is the IT head for SIMS Hospital, Ahmedabad. SIMS is a 350-bedded multi-speciality hospital in Ahmedabad city, Gujarat. Kishore is responsible for overall development of IT infrastructure and implementation of innovative healthcare IT technologies for the hospital. He's having a 15 years of experience in healthcare IT, wherein he was instrumental in introducing new age technologies for different hospitals. He is known for introducing new year technologies, which is a must for any promising healthcare and IT company, and also ensuring 100% execution and adaptation of the same. During his tenure, he had achieved many milestones. He has been awarded many of the categories like the most promising CIO, CXO Health Excellence, Next CSO 2020, Best CIO 2020, COVID-19 Superhero CIO, CIO 500-19, and Most Impactful CIO in Gujarat. Also CIO of the Year 2019, and many more. So hi, Kishore, welcome to Medicircle.
Hi, thank you.
So first of all, congrats, Kishore, for having, I mean, you've been awarded with so many good awards, and it is really, really a pleasure to have a person like you. And because, see, IT is actually the enabler to the new disruptions, which are actually getting possible, which were not possible pre-COVID. A lot of things have changed. So being a healthcare IT manager, Kishore, what are the challenges that you have faced while working?
Sure, definitely. But first of all, thank you, Smita, for onboarding on this platform and giving us a chance wherein Sims and I can give a more insight related to healthcare and technology and the current trend. So, if I can share about the technological stuff and the challenges right now, especially in healthcare. So healthcare have so many of application. Like we all know, the hospital have a PAC system, they have a HMI system, they have a different HRMS system. All these things are on a different platform, wherein it is a challenging stuff to create a single identity for the user, for the patient, for the doctor also. So while they are accessing, while they are looking the record, while they are working on the technology, for them it is a very important that they have a single sign-on technology which give you a seamless experience. So to integration is the major crunch and challenging part for the healthcare, because nowadays you all knows that technology is in a very fast mode, and people are adopting like a ABC XYZ, and they are accepting so many things Like if the management want that we want require this solution, the IT guy I say yes sir, we have a solution and we can adopt this technology. But to integrate on a same platform, to combine and to collaborate the single platform for all these applications, so that patient will get a better experience and they may not need to have worried about to accessing their data from the multiple platform, even though staff can give a supportive as well as performance on the single platform. That is a very challenging task.
Sure.
For being a CIO of the organization, we should have to take care that all the applications are talk to each other on a two-way. So that is a challenging part. And the second most important, the healthcare is not a developer kind of area, because wherein hospital didn't require to develop the much more software application, because they end outcome is not to solve that software into market. Their end outcome is to fulfill the patient requirement to give a clinical care. So to retain the best staff and the tactic staff, I must say tactic staff, those who are the real asset of the organization, to retain them, that is also another challenge nowadays, because most of the IT company per se, they are into hiring mode. They want a new people in their team so that they can give a better and better outcome to the organization. So the second challenge is to resource retention also.
Definitely. But I think it would be definitely great if IT companies actually think of absorbing the same people, retaining the same workforce, and actually helping them out how they can give more to the organization, and how they can actually collaborate. Because even that staff, the person who are working behind every department, even if they are given a good solution, they can save a lot of time, and they can be engaged in more constructive jobs rather than actually automating the solution and firing people. It is much more easier option, but it shouldn't be like that. It should be that they should be used in more patient experiences where actually a human touch is required. So I remember I was speaking to some doctor and he told me that patient does not remember the good curtains or the IT or the infra. They actually remember the doctor's smile. They actually remember the cordial behavior by the housekeeping staff. They remember how the nurses have been addressing to the patient. So that is only when possible, when actually IT is taking the forefront and it is actually solving their lot of issues, and they are more able to concentrate on the patient. So Kishore, moving on to this, like digitalization, we have seen it is like the new mantra today. Everybody is talking about digitalization, and IT has also seen a shift from a luxury to complete necessity, because nowadays it is not at all a luxury. It is a basic need. Mobile consumerism has given rise to a lot of patients who are now tech savvy. They understand, they can get notifications on their mobile, they can download their EMR reports. So, what, according to you, are the basic aspects of IT that are required when coming to healthcare?
Smita, is rightly you said, because nowadays patient want their data on their hand. You won't believe a 60 or 65-year old person, they are so techno savvy. They are able to manage their mobile. They are able to access WhatsApp. They are accessing Facebook. So you won't believe they are saying and telling to a reception staff, boss, I don't want print out. Can you send me on my WhatsApp? So
Yes.
that is the next generation or the older generation, both are come together, come up with the new requirements. So the market is demanding so much of things. So each and every want their data on their hand. They want their previous record. They want their clinical record. In nowadays, people are taking lot many of second reference also,
Yes.
because the tele consultation is very easy. Because couple of year ago, if you want to go for a second opinion, you have to go there, you have to book the appointment, you have, once you get that slot, and then only you can get the second opinion from the different doctor. But now it is a frequent second job. The moment you decide, you have an online system, so many of hospital and doctor are available online. You just have to book the slot, and that's it. From your mobile itself, you can conduct and you can do a consultation. So the need is on a different level. So the requirement is on a different level. So for the especially healthcare service provider, the IT become a part of their strategy.
Yes.
So the IT is playing a major role in a healthcare, not only in healthcare, in every sector. But rightly we're discussing on a healthcare. So the healthcare is adopting the technology, because before COVID or before 2 to 3 years ago, there are less number of teleconsultation are available. People are preferring to go and personally meet the doctor. So they want that the personal communication and face to face communication. They want to visit the hospital. But now they said, "Oh, boss, if I'm in a office, if I want to conduct my health checkup and my primary checkup,
Yes.
why don't I book my laboratory report from my own place? The people will come and conduct it. I can also do a consultation with physician. So that is a very easy. From my days, I can do my health checkup." So that is the need. So considering that need, the technology is become a necessary for all the service providers.
Yeah.
And yes, of course, with the help of technology, they are able to deliver their commitment. So if the healthcare service provider want to give a seamless experience to their patient, they definitely have to adopt the technology. And by using the technology, there are so many success case available nowadays in market.
Yes.
And easily people are getting better service with the help of technology.
Definitely. I think the IT companies are that is why pulling up their socks, because as you rightly said, the need is increasing, not just from the
True.
younger generation, but also from the senior generation, that yes, we want everything on their mobiles. And I think IT needs to support all these things for better patient experiences. Uh,
True.
Kishore, but as you know, because pre-COVID, post-COVID, things have changed a lot, and
Yes.
everything is now. We have a new term, phygital, which is a mix of physical and digital. So everything now being moving physical to going digital, and especially during the COVID scenario. So, what is your take on that? How have been things changing around Ahmedabad, especially hospitals and people out there?
Sure, definitely. See, I definitely relate this with the live situation. So, why the healthcare service provider has adopted this technology drastically, and post-COVID, especially, all the healthcare service provider are very much keen to adopt the technology. I'll give you a small example. In the year back ago, when COVID has started, the all the healthcare service provider have a challenge to manage their in and out entries, because they have to scan each and every one, they have to maintain the data, they have to submit to the government, and they have to also prepare a safety precaution for their staff as well as for their patient. So if I'm just sharing our example in the scenes, we got a requirement from the management staff, boss, we want to streamline our all in out patient visitors and staff, we want to control, we want to monitor. What to do, what can we do for that same? We cannot use paper pen, we cannot put person who can do each and every step regularly. So within a 3 days time, you won't believe, within a 3 days time, we come up with the entire digital solution wherein no person dependency, no pen and paper, nothing else. System automatically will drive entire flow. The person who is reaching on our doorstep, they have to just scan the barcode, they have to fill up and process through the pre-requisition. The machine will automatically scan the temperature. The machine device itself will give them a notification, you are fit and best for the entry
Okay.
inside the hospital. The moment they are leaving the organization, we have an end-to-end track record. So end of the day, management have a dashboard beautifully wherein they can see how many patient has visited, how many staff has visited, how many the visitor has visited the organization, and wherein we have segregated the particular respective people, those who are infected, and because of they are infected, we have diverted them into different area, and that has been taken care. And due to that, somewhere around hospital are maintaining their infection ratio. So that is a one small example of screening days. So within a 2 or 3 days time, if the technology can help you out with the entire solution from end to end solution, with the trigger, with the alert, like respective department will get the alert if any person is inside the organization, their temperature is not appropriate as per range, the automatically the other people will be prompt and come on ground to take care of the situation. So that is the strength, that is the power of the technology. And the healthcare provider are definitely aware about the technology, but they have not experimented, they have not given a challenge to the technical team. So once they given the challenge and the one they technical people will deliver it, they said, boss, that is a miracle. And if we are getting this kind of fast result, why don't we are not evaluating a new technology?
Definitely.
So after coming on that, the hospital organization has adopted tele consultation. They have adopted the digitalization in COVID area. You won't believe within a 8 days time frame, we have given a freedom to the consultant, those who are visiting in the COVID area. They can enter their note against their patient, so other doctor can refer, and they can give a appropriate detail to the relative of the COVID relative, because those who are not in organized, they cannot visit the on their place, they cannot visit their relatives. So doctor are able to do a video calling with their relatives. They are easily managed to share the history with the relatives. So that things is possible just because of technology. So the
Definitely.
doctor who are not ready to adopt the laptop or computer practice, nowadays they are practicing on mobile. They are doing this stuff. They are giving their doctor note. They are prescribing their drug on mobile. They are viewing their patient laboratory on mobile. Why? Because previously doctor are used to with the paper stuff, but we have given them in different experience wherein they can monitor patient vitals in a trained line. Like if 5 CBC performed for particular patient, doctor are able to see the trend of that particular CBC report from their device itself. There is no boundary. They may not have to depend on paper. They may not have to visit the hospital. On the device itself, they can able to view that. So the all these technical things, once they use it, once they experiment it, then they realize, boss, this is a miracle. We should have to adopt it. And this is the solution which gives us a freedom to give a better patient experience on ground. So that is a pre and post scenario of COVID.
Surely. And as you rightly mentioned about the visitors, I also have this experience like people in Gujarat actually, whenever there is a friend or a relative is sick, the entire village goes and visits. So I have been seeing a lot of hospitals in Gujarat, especially, they have to keep track and they have to digitalize this part, especially the visitor management in the hospital, which is like quite unfamiliar in other parts of India.
True, true.
So, Kishore, we have been speaking about the disruptions in healthcare IT. How has been your personal journey been? Because you have been there in this industry, you have been awarded with so many things. So, is this journey fulfilling?
See, I definitely must say I'm a blessed because I am in the organization wherein chairman and the entire board are so techno savvy, and they are always encouraging the technology. If we go with them a new, unique, innovative idea, they will definitely accept it, and they in fact promote us and allow us to implement it. So, especially if I can share my experience, I have done lot many of technology automation, especially in SIMS. In fact, SIMS is one of the first organization in Gujarat who has adopted a digital ICU technology in Gujarat. So we have a digital ICU facility in our premises,
That is
and yes, and we have implemented somewhere around more or less 85 plus module apart from EMR. Apart from EMR, we have implemented 85 plus module on ground, which covered so many of legacy process which was on paper. Say example, if the patient is coming in your organization and their discharge is initiated, and the once the system is initiate the discharge, a patient will get a notification if your discharge has been initiated, and dispatch of process will follow. And the entire track record, the patient or patient relative are able to identify where is my file, where it is moving, and what is the next step. So everything is digitalized.
okay.
Same thing we have implemented for our staff also. So I'll give you a small example. The healthcare always have a staff attrition ratio, right? So the major challenge for the organization while staff are exiting. So since last during their days, last 2 to 3 days, the staff have to engage with all this activity like the exit NOC and the exit interview and clear all these things. So many blah 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 processes going on. So
Yes.
most probably most of the resources are occupied to clearing all these things during their exit days, especially for last 2 to 3 days. We have done entire digitalization in that process. Once they put their resign, system will notified automatically all the respective peoples at the end of the last day. Person may not have to visit area, person may not have to go for the any clearance and all. System will take in place. The respective person will clear all the due diligence and everything, and the person required only 15 to 20 minutes to spend in the HR department to collect their documentation, and that's it. So the person can actually give a proper handover during the last days. They may not have to invest time for the extra stuff. So this kind of digitalization I have implemented in the organization, because that happened. Just because of that, I work on the strategy. I should have to go on ground. I may not have to sit on my IT area, and I may not require to see the entire dashboard. I should have to go on ground. I should have to check the requirement. I should have to check the reality of the ground. What is user are practicing? What is their exact practice, and how we can easy their practice? Otherwise, the major another challenges is to adoption and implementation. You won't believe, out of 85, 98% compliance is available, and which is on a dashboard. All the modules are 100% in utilization phase. Most of the organization have a challenge. The IT people, yes, IT people may always create a new things, but it is not in use. So there is no benefit on organization level. So if it is in use, then and then it is in the beneficial stage. And how I see the opportunity, once I get the requirement, once I see the opportunity on ground, I should have to access, I should have to go into detail, I have to deep dive it. And if I give a module which is a user friendly, which is a easier than their regular practice, then definitely user will accept. And that is a mantra of the digitalization. If you give them a software which is very easy, which is very user friendly, and which will give a add-on in their regular practice, which will solve their regular process and challenges, the user will definitely adopt it. So that is my take home from my entire journey. If I will go into deep dive, if I will go and access the user things, that will definitely give a result into it.
Sure. So it was lovely talking to you, Kishore, and I definitely believe that IT managers and CIOs like you would be better implementing more solutions to enhance the patient care delivery process and also the patient experience. Because a lot of IT companies actually have a lot of solutions with them, but yes, the usability is always a challenge. The implementation is always a challenge. We must ensure at the grassroots levels, like this is being done, people are using the solutions and the utilization is happening at the grassroots levels. Thank you so much for sharing the significant information with us at Medicircle today. We wish you all the best for all your future endeavors.
Okay. Thank you so much. Thank you.